The Newsday continues here on One News Now. I'm Riza Diaz. The Philippines' COVID-19 caseload has breached the 500,000 mark. Just today, over 1,800 new infections were reported, pushing the active case count to over 24,600. The highest spike in new infections was seen in Davao City, where 107 fresh cases were recorded. The virus claimed the lives of 11 more patients in the past 24 hours, bringing the death toll to nearly 9,900. Now, some 465,000, meanwhile, have gotten better from the disease, with over 5,800 new recoveries today. Now, across the globe, COVID-19 cases have reached the 94,500,000 as of 3 p.m. based on the data from the Johns Hopkins University. The number of recoveries worldwide, meanwhile, has surpassed the 52 million mark, while global deaths stand at over 2 million. Now, authorities from the Customs, the Health Department, and the NAIA warehouse have started coordinating to prepare for the arrival of vaccines in the country. BoC-NAIA led the conferences of the partner agencies on January 13 and 14. District Collector Carmelita Talusan said NAIA Customer Care Center and the COVID-19 one-stop shop for vaccines will accommodate and assist incoming importations through the port of NAIA. The Customs said they will continue to be vigilant so that no unsafe or unregistered goods will enter the country. Gold chain operators in the country who have the potential of playing an important role in vaccine distribution have also offered to help in preparations for incoming vaccines. Let's get more details about this story. We have with us the president of Cold Chain Association of the Philippines, Mr. Anthony Dizon. Sir Anthony, good evening.
Yes, good evening, Lisa. Thank you for having me tonight.
Thank you for your time. Sir, have you received an official word from the government yet on distribution plans, and have they tried to coordinate with you?
Unfortunately, up to now, we have not received any official representation from any of the government agencies involved in the vaccine distribution program to inform us whether, in fact, the private sector will have an active role in the activities that will be needed to make the vaccines available to different parts of the country. We have manifested on at least 2 occasions our capability and our interest in participating in the program, and we are now just awaiting for an official reaction from the government agencies concerned.
Sir, Secretary Duque said they have already talked to at least 18 companies involved in cold chain management. What are your thoughts about this?
Well, I overheard Secretary Duque say that during the Senate hearing last Friday, because I was also in attendance. I remember him mentioning a number of names that actually pertain to members of the association. And I'm happy in realizing that they have made direct representations with these companies. But despite that, the main reason that we wanted to coordinate with the Department of Health as an association is precisely for us to be able to recognize all the rules, the restrictions, and the terms of reference that need to be understood by the industry if we need to play a role in the distribution of the vaccines nationwide. The names that are mentioned by Secretary Duque last Friday are all companies that are situated in Metro Manila. I have information that these companies have also been contacted by the respective LGUs where they are located, and to that extent, therefore, that serves a useful purpose. But I have yet to be informed as to the overall program that has to be put in place with respect to the distribution of vaccines to the different provinces around the country.
Well, as you know, we're expecting Pfizer shots, sir, to arrive next month, and this particular brand requires ultra-cold storage. Can you tell us more about the capability of your company to store such vaccines?
Well, the association actually has at least 2 members who have the capability to store vaccines at -70, and therefore that puts them in good position to help in the activity pertaining to Pfizer vaccines. Admittedly, however, the capacity of these members to store Pfizer vaccines will be limited to the capacities that they have now because these capacities were installed in the past to serve a different purpose. And it is only now that we have encountered a need for capacity at minus 70 to the magnitude that we are discussing now. So the member companies have also indicated that if it is necessary, they will be willing to make the necessary investments to upgrade their capabilities to whatever extent is needed. But that is precisely the reason why we need the information so that we can also prepare whatever plans need to be put in place.
Mr. Dizon, as for the association is involved, have you already crafted a possible logistic plan, especially as we're expecting to transport some supplies to other urban areas with cold storage facilities like Davao and Cebu?
We have a program in place that can respond to those requirements if need be. And that is precisely why we feel that it would be expedient if the government were to reach out so that we could coordinate whether the system that we have crafted is essentially in sync with what the government has planned for itself.
Sir, would it also be possible to ship supplies to far-flung areas to make vaccine distribution more equitable?
Again, Lisa, this would depend on the nature of the vaccines that we actually bring in. If that is precisely why you remember that Secretary Duque and the other agencies involved have mentioned that the intention was that if we are talking here of Pfizer vaccine that requires a special ultra-cold storage conditions, then these vaccines would probably be limited to distribution in NCR. Quite apart from that, the other vaccines that may require more moderate temperature conditions can be distributed to the far-flung areas, subject to the availability of support equipment, transport facilities, and the absorptive capacity of the last mile, meaning where the locations where the vaccines will actually be administered. We can't take the risk of bringing too much vaccines to a particular remote area only for the vaccines to be in oversupply. And if the temperatures cannot be protected, then the vaccines will spoil. Mm-hmm. And this is precisely the reason why we need detailed, granular planning to be able to develop a plan that will be implementable.
Well, thank you, sir, for those information and for your time, Mr. Anthony Dizon of the Cold Chain Association of the Philippines. And we'll be back with more stories after the break. Keep it here on One News. You're still watching One News Now. I'm Riza Diaz. Several senators weigh in on the government's procurement of COVID-19 vaccines. Following the Chinese government's donation of 500,000 vaccines, Senator Kiko Pangilinan says the government should not settle for pwede na vaccines or those that merely pass the standards. Pangilinan adds that while the donation from the Chinese government is welcome, it should not pressure local regulators to approve the use of vaccines. He said science, data, and clinical trials should remain the basis of vaccine authorizations and not political goodwill. Senator Ping Lacson, meanwhile, notes that the sharp price difference in Chinese-made Sinovac vaccine smacks of corruption. The senator cites reports that Sinovac may cost as little as $5 or 240 pesos per dose in other countries, yet can be worth $38 or more than 1,800 pesos in the Philippines. Lacson says if it were true that the government is dropping the price, the Senate has probably done its share to save billions in taxpayers' money. Now, as for COVID-19 vaccines that will be distributed to Muslim Filipinos, Senator Amy Marcos calls on the government to ensure that they are halal. The senator suggests vaccines already granted emergency use authorization in other countries, such as Saudi Arabia, could be rolled out for Muslim Filipinos. She also says that the government could consult with halal certifying bodies before finalizing the allocation of vaccines, especially to the Bangsamoro region. And now here are other stories we're keeping our eyes on. Indonesia's Mount Semeru has erupted, spewing ash and smoke more than 5 kilometers into the sky. No evacuation orders have been issued so far in Java. Its National Disaster Mitigation Agency, however, warns villagers living on the mountain slopes to be more alert for ongoing volcanic activity. Other volcanoes such as Merapi on the island of Java and Sinabung on Sumatra have also shown signs of activity recently. Meanwhile, a wildfire that is thought to have been started deliberately has turned the sky red over in Chile. Authorities say that at least 10 houses in the Valparaiso region have been engulfed by the flames that have been sweeping through a forest area. Now, officials have ordered the evacuation of some 25,000 residents while hundreds of firefighters were deployed to help battle the fires. No deaths or injuries have been reported so far. And for the first time, NASA ignited all 4 engines of its Boeing Deep Space Exploration rocket. But the engine test lasted only for a minute, well below its 8-minute target that would simulate the conditions of a liftoff. This sets back the U.S. government's program to return astronauts to the moon by 2024. And those are the top stories of the hour. Join us later at 8 o'clock as we continue to monitor the day's biggest stories. You can also catch One News on Signal Play app. Register for a free account now at www.signalplay.com and stream One News live anytime, anywhere. I'm Riza Diaz. We are One News.